How can you help a loved one or a friend, a family member with mental illness? First of all, I'm going to tell you that it is very painful to have someone you love struggle with mental illness. It is painful to watch. It is, you have to grieve the loss of the person that you knew before the mental illness hit, or the person that you hoped that child would be, or your spouse would be. That's a loss, a huge loss. But there are ways that you can help and ways you can deal with this. So one of those is first is to recognize the person is struggling. And if you don't know what it is, you can help the person get to maybe a psychiatrist or a therapist to get a diagnosis. Once you have a diagnosis, you need to learn everything that you can to understand that diagnosis. What does it mean for a person to have general anxiety disorder? What does it mean to be bipolar? What does it mean to have schizoaffective disorder? What does it mean to have major depression or OCD? To learn everything you can. This will help you to recognize behaviors. It will help you to support your family member and your friend, and to offer compassion. It will help you to have realistic expectations and to kind of know, when do you need to let go of something? When do you need to step in? So learning everything you can about that diagnosis and getting that diagnosis first if you don't have one. Joining a support group. There are support groups available through Grace Alliance, through National Alliance of Mental Illness. Grace Alliance is a Christian organization. Some churches have groups for those. They do have resources. Mental Health Strong is a friend of mine runs that nonprofit that helps spouses support their partner with a mental illness. And there are others that are out there as Christian groups that can help you if you'd prefer to have a Christian group. The next one is to detach from the person's symptoms by recognizing that it is the illness that is acting out, not the person. The person does not mean to do those things to you, doesn't mean that they're not responsible at some point to do something about it, but to not personalize it, to not feel like that person's behavior or that person's reaction is like directed at you because of feelings they have about you in and of themselves without the mental illness. Have a plan to deal with mood changes or worsening of the mental illness. It's like an emergency plan set up that you have, like in case of a disaster. This is absolutely necessary because you need to know the symptoms of when this gets maybe life-threatening, when suicide could be a problem, or behavior that could harm themselves in another way, like maybe taking a lot of drugs or having risky sex or something. When someone gets in a manic mood with bipolar, there's a lot of harmful behavior that they can get into. Also, you need to have like an idea of when do we take the person to a mental like hospital and put them in the hospital for a few days, or when would they need like a treatment program when things are actually getting worse. Now, doesn't mean they're instantly going to agree with that, but at least you'll know this is behavior that is getting to a point where there's a problem and we need to do some type of intervention. If in doubt, you can always call 911 and have the police come out. They sometimes bring a team with them that is specialized in mental illness and knows how to assess if somebody is in a dangerous state. Remember that you cannot fix this. You did not cause it. In Al-Anon, they have the 3 C's. You didn't cause it, you can't cure it, and you can't control it. I often add a 4 C, but you can choose how to respond to it. And that is really important, that you can choose how to respond to your loved one with this mental illness. You want to recognize that your family member with this does fear relapsing or getting worse. There is some fear around that, especially if the mental illness has been worse at time and they start to get a little bit better. It is normal to have lots of side effects from psychiatric meds, and no one likes side effects. They're hard to deal with. And the more meds you take, the more your side effects are going to be. And often someone with mental illness will want to stop taking medication when they start feeling better because they think they don't need it. So you have to figure out a way, in as much as you can, to encourage that person to take medication or help that person take medication or help the person recognize the benefits as opposed to the side effects, or maybe have them sign something when they're really not doing well, that this is how I am, and describe it when I'm off of my meds, and I promise to not stop taking them. You can set boundaries. National Alliance of Mental Illness, NAMI, says that you do not have to have a family member with mental illness stay in your home if that person is dangerous or if it is literally disrupting the environment for everyone and causing, too much harm to come to you, your spouse, and or your other children. So that is a very painful step to have to take. I know people that have done it, that have made the decision that their family member, usually an adult child, sometimes a spouse, is dangerous, and had to put them into a program or a assisted living type situation, or even allow them to be homeless because they refuse to get any treatment and take medication or get help. So painful. When you are dealing with somebody with mental illness, it is hard to figure out how to live your own life and to do what is necessary or you feel you need to do for that person. It can literally completely just take everything out of you. So I have a rule, and I have used this in my own life. You put yourself first. You do what you need to do, but you don't let the mental illness of another person rule your life and come before other things. You have to have boundaries. You can't drop everything to go do whatever that person needs. You can't cancel, or should not cancel, vacations and cancel your things that you have in your life that are important to you or fun for you, or your social life, or your own health that you need to take care of, or your own sobriety, or your emotional sobriety. You have to, it's like being on a plane where they tell you put the oxygen mask on yourself first before the child or the elderly person sitting next to you. If you do not, you may not still be alive to help that person or to put the mask on that person. You got to put the mask on yourself when you have somebody with mental illness in your life. You have to take care of yourself first so you'll be strong enough for you to be able to help that person. And that help comes in the form of doing things for that person cannot do for themselves. I always push the person to do a little more than they can comfortably. So it's not expecting the person to be normal, but it's expecting the person to try and the person to do something about as much as they're capable of with treatment, because they need treatment. They need to be in therapy and they need to be under psychiatric care. Typically, if it's not something that's very mild, then in that case, anxiety or depression, you can go to like your medical provider will sometimes give you medication for things that aren't super bad. But when somebody is dealing with that, you have to recognize that there is only so much you can do. You can't fix it, you can't cure it, you can't control it. NAMI calls the mental illness a brain disorder. And it is a disorder of the brain. It's a disorder of the mind. It has to do with the body too. Our body produces sometimes serotonin, even in our gut. And there's a complex system of hormones that works in our brain and has an effect on all parts of our body, and emotions also. The mind and emotions are very interconnected. Sometimes in the Bible, you can't even figure out, is the verse talking about the mind or the emotions or the will, when it talks about heart or when it talks about the mind. It's so we're very complex creations, and our mind is sometimes affected. So also, like I said, you want to have boundaries in the home. There's certain things that have to be abided by. You can have things that the person has to do, things that you don't allow in order for them to stay in your home. And one of those can be that you have to be on medication and you have to be seeing a psychiatrist or a therapist. You have to be doing something to get better, or you can't be in the home. Mental illness often uses substances, whether it's drugs or alcohol, just to manage the feelings and the pain. And it's high correlation. So it is okay to have a rule that, or a boundary that, if you're going to be in the home, you have to get help for your substance use. You can't use your mental illness as an excuse to take substances and still stay in the home. So maybe you need to go to AA, or need to go into a treatment program to get clean or sober. So those are okay. You are allowed to have that. You're not going to be a victim of somebody in your life with a mental illness. You want to be patient, compassionate, and understanding, because a person with mental illness does not process things the same as a person without mental illness. They're not going to be able to reason the same way. They're not going to be able to rationalize the same way. They're going to not be able to focus. They're going to maybe draw conclusions that are not what you meant to be drawn. So you got to be very patient. It's not the person's fault that they have mental illness. Now, if they have taking substances, obviously it is their choice to take that substance. But substance use is also, like I said, has a genetic component in my belief, and it's also very linked with trauma. When there's been trauma, to avoid the pain that the trauma has caused emotionally and mentally. You want to also not fall into the stigma that mental illness is a sin, or that mental illness is a demon, or that mental illness is a curse, because then you are not offering your family member or friend help. If you're going to believe that if it's that spiritual realm, then if all you have to do is pray it away, and then it doesn't go away, where do you leave that person? And be careful when you pray for somebody with mental illness. And this often happens when people go up to a prayer team and they'll pray, God, take this anxiety away. If you're dealing with somebody who has true, deep, strong mental illness, God is not going to just lift it off that person. I mean, there may be a few people who say that they've encountered that, but for the majority, that does not instantly go away. It is something that takes lots of therapy, lots of medication, and there are many people who will live with mental illness forever. They will have to take medication forever. They will always fight the OCD. They will always fight the voices. They will always fight the depression, always be prone to anxiety. And we want to have compassion toward those people. And we want to be able to sit with them and understand, and not minimize it by saying, let's just pray that God heals us and takes it away. When God doesn't change the way that their brain works, doesn't instantly take the trauma that they've experienced away, that is a part of or a root of the mental illness. So be very careful. You do not have to feel ashamed or embarrassed or of your family member's mental illness, nor do you have to tell everyone. It is not something that people are entitled to know, but it is also something that you need to not feel is shame from on your part that you raised a child or that you're married to somebody or that you personally have mental illness. There is a stigma. There should not be a stigma. We need to fight against that and to understand, not assume things about people with mental illness that is not true, especially in the church. We want to make sure that we have our expectations for the person with mental illness as simple and clear as possible. And again, recognize the things that the person can't do and not get frustrated with having expectations that are unreasonable and causing that person to feel even more shame and even more discomfort. People with mental illness feel bad, most of them, that they are causing you to have to do extra things for them, that they are requiring you to take care of them or help them. They do worry often, especially with anxiety or depression. They do worry about the burden that they're adding to you. So you need to show them that you're still taking care of yourself, that you're still living a full life, that you're not pulled down with the same depression and anxiety that your loved one has, but that you can be okay and still love them, but still live your life. That makes them feel better. So I hope that this has given you some ideas of how you can help your loved one deal with their mental illness and also how you can help yourself. So I will put some resources, some organizations in the notes with the video. And also if you're listening to this on podcast, lead you to some other organizations that will be helpful. So thank you for watching. God bless you.